Hello everyone, my name is Dr. Larissa Assam and I am a board certified family medicine physician and I am also the founder of Rofi Concierge Medicine. I have noticed that there is a lot of misinformation around pregnancy, and so I've decided to start what I'm calling a series talking to you not only about pregnancy but really aiming to educate you about what a natural pregnancy is and how you can best optimize your body even before you get pregnant to have a natural pregnancy. I felt the most important step with this series would actually be explaining what a natural pregnancy is. I find that this is a term which is thrown around quite a lot and is used loosely, but for all intents and purposes of the information that I'm going to share, I want to explain to you what I mean by a natural pregnancy. So simply put, a natural pregnancy is simply defined as a pregnancy with limited medical interventions. This means throughout the pregnancy, you're optimizing yourself, you're optimizing your health to decrease the need for medications and the need for procedures, including surgery. In the case of pregnancy, that would be C-section. Now, this is something that is debated all over the internet, but I want to be very clear and simply state that this should be the standard of care for every single health condition. So there really shouldn't be a thought to think that you're going away, you're straying away from anything that isn't exactly what you should do, right? By training, I am a primary care physician. And so what that means is I'm trying to think of ways to prevent disease, or if the disease is present, to reverse it. And a lot of that can actually be done simply using lifestyle interventions. And so a lot of what I will be talking about through this series will involve lifestyle interventions. So as I've mentioned, the very first thing is ensuring that you're minimizing the medical interventions, medications and procedures, okay? The next thing that is necessary, as I was just discussing with a natural pregnancy, is really the focus on lifestyle. Now, this includes nutrition, so what exactly you're eating. This also includes exercise, moving your body. When it comes to nutrition, you want to make sure that you're eating whole foods, you're eating unprocessed foods, because we know that there is a correlation between processed foods and any type of chronic disease development. This also happens in pregnancy, and this also, if you're able to eat whole unprocessed foods, that will also reduce your risk of developing complications during the course of your pregnancy. I have developed, by the grace of God, a prenatal protocol. And in this protocol, I actually check in with my patients on a weekly basis. During that time, we are able to have a plan. It's very clear how many meals you should have every day. It's very clear what times of day you should even eat. And I have also taken this information and turned it into an ebook, which is called the Cherishing Pregnancy ebook, because I found that a lot of women were genuinely very afraid of getting pregnant, and that just should not be the case. But what we need is women to be empowered, and I dare say couples, because men are actually a very important part of this process. So this book actually is written for everyone. Everyone needs to be educated. It has everything you need to know, from before you get pregnant to what's happening at each week of the pregnancy, to what to do during labor, how to know it's time to deliver, what to do when it's time to deliver, and even what to do after you give birth. So there are two ways you can work with me. One is you can work with me in the protocol, in the prenatal protocol, or you might decide, okay, I already have a great relationship with my doctor, but I want to build on my knowledge base. Get the ebook, gift it to someone. That's another incredible thing that you can do. The next thing I want to just mention is that when we're talking about natural pregnancies, in addition to the standard medical care, we also think about things like massage, if helpful. We think about the pelvic floor, right? Pelvic floor therapy. We think about supplements, I carry this belief that the prenatal vitamin is good, but there's so much more that you can do during the course of your pregnancy to prevent potential complications such as preeclampsia and gestational diabetes. These supplements are discussed in the ebook and also in the protocol. And then finally, teas. There are some teas which are very common, and if you're able to incorporate these into your pregnancy journey, they can significantly contribute to making your pregnancy, and I dare say your labor course, a little smoother. Now, with natural pregnancy, we also have to talk about pain management. Now, many people who kind of go the standard route will decide to get an epidural. And let me be clear, there's nothing wrong with getting an epidural. If you decide that that's what you want to do, that is totally fine. If you decide that that is what you want to do, that is totally fine. I just want you to be well versed in other things which can be helpful with pain management. Things such as breathing exercises, warm baths. There are some people who talk about hypnobirthing. That is not something I actually recommend within my practice, but know that it does exist in the world. I am Christian, so I am very strict about what I do and do not incorporate into the recommendations I make for my patients. And the last thing is even thinking about the birth environment. Do you want to deliver in the hospital? Do you want to deliver at home? Do you want to deliver in a birth center? I just find that it's very important for people to be well versed with what their options are so that they can make well-informed decisions. So I will stop here, but I hope that this short video has been helpful at simply explaining to you what a natural pregnancy is, what a natural pregnancy course could look like. If you would like to learn more about this, please make sure you leave comments. Make sure that you share this as well with others, because this is something that everyone should be doing. This shouldn't be something that is quote unquote reserved for people who are anti-medicine or anything like that, right? The medical interventions exist if they're needed, but I always push, as with all my protocols, there's so many things that you can do without a pill, before a pill. The quick fixes, we don't want them anymore, right? That's not what we push. That's not what we encourage around here. We want people to make necessary lifestyle changes that will just optimize their bodies to really heal themselves and to live the way God intended for them to live. Long, healthy, thriving lives. Please make sure you share this. Thank you for your time. Bye.